What is a hernia? A hernia happens when an internal organ or tissue pushes through a weak spot in the muscle or tissue wall that holds it in place. It can cause a visible bulge or lump, often in the abdomen or groin area. Sometimes, parts inside your body, like your intestines or fatty tissue, can push through weak spots in those walls. That's a hernia. It's like a small bulge or lump, kind of like when you push your finger into a balloon and it pokes out. Hernias often happen in the abdomen or groin area. Symptoms. The symptoms of a hernia can vary depending on the type and location of the hernia. However, some common symptoms include 1. Visible bulge or lump. You may notice a bulge or lump under your skin, especially when you're standing up, coughing, or straining. This bulge can sometimes disappear when you lie down. 2. Discomfort or pain. You might feel discomfort or pain in the area where the hernia is located, especially when you're lifting heavy objects, bending over, or coughing. 3. Weakness or pressure. Some people describe a feeling of weakness or pressure in the affected area, like something is pushing outward from the inside. 4. Burning or aching sensation. There might be a burning or aching sensation at the site of the hernia, particularly after standing for long periods or engaging in physical activity. 5. Digestive issues. If the hernia involves the digestive tract, you may experience symptoms such as heartburn, acid reflux, difficulty swallowing, or abdominal discomfort. 6. Swelling or bloating. In some cases, the area around the hernia may become swollen or bloated, especially after eating or exerting yourself. Types of hernias. 1. Inguinal hernia. This is the most common type and happens in the groin area. Men are more likely to get these. 2. Hiatal hernia. This one's a bit different. It's when part of your stomach squeezes up into your chest through a hole in your diaphragm. 3. Umbilical hernia. Ever seen a baby with a little outy belly button? That might be an umbilical hernia. It's when part of the intestine pushes through the abdominal wall near the belly button. 4. Incisional hernia. This type happens at the site of a previous surgery where the muscles might be weaker. 5. Femoral hernia. Similar to inguinal hernias but lower down in the groin, usually more common in women. Causes. 1. Weakness in the abdominal wall. The abdominal muscles can weaken over time due to factors such as aging, genetics, or previous surgeries. 2. Heavy lifting or straining. Activities that involve heavy lifting, pushing, or straining can increase pressure in the abdomen, potentially leading to a hernia. This is particularly true if the abdominal muscles are weak. 3. Chronic coughing or sneezing. Conditions such as chronic coughing due to smoking, asthma, or respiratory infections can also contribute to the development of hernias by putting repeated strain on the abdominal muscles. 4. Pregnancy and childbirth. The increased pressure on the abdomen during pregnancy, as well as the strain of childbirth, can weaken the abdominal muscles and contribute to the development of hernias, particularly in the groin area, inguinal hernias, or around the navel, umbilical hernias. 5. Obesity or excess weight. Being overweight or obese can put extra strain on the abdominal muscles, increasing the risk of hernias. 6. Straining during bowel movements. Chronic constipation or straining during bowel movements can also increase pressure in the abdomen and contribute to hernia formation, particularly in the groin area, inguinal hernias. 7. Certain medical conditions. Conditions that increase intra-abdominal pressure, such as ascites, fluid buildup in the abdomen, chronic obstructive pulmonary disease, COPD, or enlarged prostate, can also increase the risk of hernias. 8. Family history. Hernias can sometimes run in families, suggesting a genetic predisposition to weakened abdominal muscles or connective tissue. Treatment. 1. Wait and see. If it's small and not bothering you much, your doctor might just keep an eye on it without rushing into treatment. 2. Supportive gear. They might give you a special belt or truss to wear around the hernia to help support it. 3. Surgery. For most hernias, especially the painful ones, surgery is usually the best option. Surgeons push the bulging bits back where they belong and patch up the weak spot with stitches or a mesh to help keep it from happening again. Thank you for watching. Please like, share, and subscribe my channel.